Hi, and welcome to the show. Subscribe at kevinimney.com/podcast and get CME for this episode by clicking on the CME link in the show notes. Today, we welcome back Scott Ellner. He's a general surgeon, founder of Peak Health Technologies. Today's Kevin MD article is The Doctor's Digital Twin Will See You Now. Scott, welcome back to the show.
Great to be here, Kevin, as always.
Scott's been on multiple times. Go to kevinmd.com/podcast to hear his story and prior episodes. But today, let's talk about your most recent one. The Doctor's Digital Twin Will See You Now. What's this one about?
Okay, so imagine that in real time or near real time, you want to access your healthcare provider for a non-emergent concern or question. And what I mean by that is essentially you have to refill a prescription, you have to see someone for an ailment, and many times we have to wait. We have to go through a process of scheduling, getting an appointment, or even having to drive to an urgent care or logging into a telemedicine appointment. In fact, when I was a CEO of a health care enterprise for a physician group, we tried to make sure that patients could be seen within 24 hours. And that was mostly with a nurse practitioner. But what this article is about is actually having access right away to a healthcare provider. And that healthcare provider is, believe it or not, an avatar or a digital twin of the actual physician who has all of your personal, private health information that is HIPAA protected and is able to talk to you as if they are the actual physician.
So tell us an ideal scenario where that can happen. And given the advances in large language models, if they have access to your medical records, that's certainly in the not too far distance future.
Well, you're right. So, and you mentioned large language models. So these are all terms under the subfields of artificial intelligence. And I want to also make note that the American Medical Association, most recently, likes to refer to AI as augmented intelligence because we're not supplanting the role of the physician. What we're doing is we're augmenting the role of the physician through this augmented intelligence. You talked about large language models, there's machine learning, deep learning, and other fields such as natural language processing, which are able to decipher a significant amount of data about you as the patient and then come up with a treatment plan which is personalized for you in real time. And so there are companies that are working on this. There is one that just received a significant investment and I believe a round of Series A funding. And I'm also working with a company as well where we're developing these digital twins that are accessible through a virtual healthcare marketplace where the information is right there and you can access what you need. That's as long as it's non-emergent. And so what we're essentially doing is we're addressing the pain points that are happening within healthcare today. And I'd love to share with the audience how we're doing that because I know that many physicians are absolutely frustrated and tired with the administrative burden that is being placed on them.
All right. Give us some ideal scenarios where you see the digital twin in action.
Okay, so let's say you wake up after a really great 6 hours of sleep and you look at your wearable, your watch, and it's telling you that unfortunately you've got some changes going on in your ECG. You're not sure what it means, but you can actually log into a HIPAA-protected portal and ask your physician based on an alert that went to your watch or wearable and ask them, is this something I need to be concerned about? And if the physician is not there because it's 4 o'clock in the morning, their digital twin or their augmented avatar will be available to provide you information on how to respond to that alert. Another area is if you're away on vacation and you ran out of your medication that you need, this is an opportunity to, in near real time, get that medication delivered through different mechanisms by having that avatar available anytime for the patient. Now, of course, for the physician, what this does as we get through the regulatory hoops, what this does is that it also allows the physician to see more patients. And it gives the physician, the live physician, the person, more time to interact one-on-one, to have that relationship, that physician-patient relationship that we all went into medicine for. While some of the other administrative tasks, the burdens of scribing the notes and putting together a comprehensive note for billing purposes can be done by the augmented intelligence through this digital twin. And the AMA did a survey of asking physicians, what about augmented intelligence is something that you're looking to improve healthcare? And 71% of the respondents said it's to relieve the burden of all the administrative paperwork or computer work, EHR work, that is now part of their role, as well as other things like insurance pre-authorization, which is another barrier to enjoying the physician's day or finding meaning in their work.
Are we there yet with large language models where we can trust the medical information that they may be dispensing?
So it's a really good question, and it's an important question based on ethical guidelines and legal ramifications. Are we there yet to trust the information to dispense physician grade advice? Probably not yet. But I would say that in a few years, as we start to get our hands around and really understand the capabilities of large language models, machine learning, machine understanding, and how to apply this information in a meaningful way, which will actually enable patients to feel more empowered about their healthcare, enable physicians to practice the joy of medicine. We're going to get there, and I don't think it's too far off. I believe it's about 5 years in the making, maybe even sooner. But the access issues for patients is so challenging that we need to find another way, because there's going to be a shortage. There's going to be a shortage of available primary care physicians, even with the rise in nurse practitioners and other allied health professionals. So today we're not there, and there are other reasons as well that I'll go into.
So, in terms of things like privacy, data breaches, these are concerns that we have with the current iteration of large language models, right? So, what kind of precautions can the healthcare community take when this technology is being used as a doctor's digital twin to guard against these privacy breaches or security breaches?
Well, we're all familiar with what happened recently with the cyber attack at
Hmm.
Change Healthcare, which has been incredibly disruptive toward physicians and getting payments. The concern that you're raising around that protected health information under the HIPAA privacy rule is a real one. And I would say that while this sounds incredibly promising, we have to remember that it is utmost part of the duty of care to ensure that we are able to attain privacy in patient records, protect that information from cyber threats, from physical threats or others, and to maintain confidentiality. Right now, there are things being worked on in order to create a mechanism to protect these threats. But again, the technology is so new with this augmented intelligence that we're not quite there. So there is going to have to be a regulatory framework around the HIPAA privacy rule and probably the FTC if these are third-party vendors, because you remember HIPAA privacy only applies to covered entities.
Mm-hmm.
And so the FTC will probably have to get involved for breaches in order to protect that information.
You mentioned 5 years until this can come to fruition. What needs to be done between now and 5 years from now in order for this to become reality?
Yeah, so 5 years isn't that long. And so between now and the next few years, we really need to scrutinize the databases, the data that's out there. You know, ChatGPT 3.5 is now pretty archaic. It's becoming obsolete. They've moved to a new version of 4.0. And one in 20 physicians are using ChatGPT, mostly for personal reasons, but it's not robust enough to really provide the right type of medicine that we practice on a day-to-day. What's going to happen is a large language model which focuses on biological variables, environmental variables, social determinants will have to be developed in order for this to truly be the right kind of model in the future. And I would say one of the reasons why we're not there also is the algorithmic bias in the data. And I'll share an example of what I mean by that. The algorithms today are really focusing on the typical white male like me. And there's bias inherent in the development of these algorithms, which don't take into account the disparities in healthcare. And there are actually studies that show that different races, different ethnicities aren't as developed in the large language models to actually provide the right type of care through these mechanisms, through this augmented intelligence. An example is, if you're looking at skin cancer screening on patients, the AI technology and software has a difficult time looking at darker skin to really determine if a mole or some other growth is cancerous on a patient who is from a different ethnic origin. So there's a lot of work to be done on that end. Again, the legal regulatory framework, the cultural bias, the social bias. But over time, I do believe that there are some really smart people who are working on these algorithms to make it so that at some point, because of the access issues that we're facing today with physician shortages, this will become a framework in the future.
So it's very conceivable in the next 5 years, we can have that avatar of us, a clinician with access to patient data, virtually see patients, ask questions, prescribe medications seamlessly, automatically through this augmented intelligence. Is that what you're saying?
It's conceivable. Yeah. And again, I'm not advocating to supplant the role of the physician. What I believe here is the opportunity to remove the biggest burden that physicians face today, which is that administrative burden of truly not spending time with that face-to-face interaction that we enjoy, and really why we pursued our calling to interact with patients. Ideally, the augmented intelligence that will develop within the healthcare industrial complex will be to eliminate the pain points that we're feeling and recreate the joy and meaning that we're all searching for as physicians.
Now, if these avatars are advanced enough that the information that they're dispensing is trustworthy and they can prescribe medications, what's preventing hospitals or healthcare institutions simply to replace live clinicians? I know that certainly wasn't the intent, but not everyone may share those same values and ideals. What's to stop them to simply replace clinicians with this cheaper alternative that may be almost as trustworthy?
Yeah, and that's an important question because again, you're raising some ethical and moral issues. At this point, I don't think hospitals or health systems are looking to replace a live person who is doing their job well. I would reframe the question to respond that we're looking to augment and remove all the administrative burden that is going into the work that's important for pharmacists, for pharmacy techs, for CNAs, nurses, physician assistants, and as well as physicians. We don't want to take that take away the human interaction, the humanistic approach to medicine. But certainly, I think if a hospital or health system is struggling with finding the appropriate workforce to meet the needs of patients in the community for access to care, this is an option.
We're talking to Scott Ellner. He's a general surgeon, founder of Peak Health Technologies. Today's Kevin MD article is The Doctor's Digital Twin Will See You Now. Scott, as always, will end with some of your take-home messages to the Kevin MD audience.
So a couple things for take-home messages is that number one, the American Medical Association is promoting augmented intelligence. We're not calling this artificial intelligence because we're not replacing the role of the physician or other important healthcare professionals. The augmented intelligence is an important step toward reducing the administrative burden that many of us as physicians are feeling every single day with taking away the important patient interaction, one-on-one time that we enjoy so much. And augmented intelligence should create an evolution of working with payers for better reimbursement models and hopefully streamline the payment mechanisms. And finally, we're going to have to work on developing a mechanism through augmented intelligence that takes into consideration conscious and unconscious biases, which are occurring right now in the data in which these large language models and machine understanding, machine learning techniques are being developed. There's more work to be done. As I mentioned, it's about 5 years away from actually seeing this in production, maybe sooner. But the legal and regulatory framework is also going to step in to ensure that it's safe and effective. And so it's exciting, yet on the other hand, we must assume caution and take on this new technology with a skepticism, but an optimistic approach.
Scott, as always, thank you so much for sharing your perspective and insight. And thanks again for coming back on the show.
Thank you for having me, Kevin.